Amid a global pandemic, an underlying health crisis drags on.
Every day we delay, we're just allowing more and more kids, more youth, to become addicted to these products.
Vapes getting into the hands of our kids at alarming rates, doing serious damage to their physical and mental health.
A lot of the flavorings that people use, especially the red ones or the fruit punch flavors, they go directly into your lungs and eat away at the tissue.
A coughing storm erupted and I never wanted my body to feel like that again. It was scary.
Now, some state legislators and policymakers are taking on big tobacco.
Fighting the tobacco industry is a little bit like whack-a-mole.
Going after the big business of flavored products here in Connecticut. Opponents argue responsible adults are going to get burned.
To include traditional tobacco products that have very, very small and narrow youth appeal is really only going to affect adults in the state of Connecticut.
We don't want to hurt kids. They have a long life ahead of them. But we don't want to hurt adults either.
It's not just fruit-laced, candy-coated vape flavors they're taking aim at. It's menthol cigarettes, too, amid claims the black community is being targeted deliberately.
There's specific evidence here that they target specifically African Americans in smoking of the menthol cigarette. This is almost an act of genocide when you sell menthol cigarettes.
The livelihood of hundreds of small businesses on the line.
We will be losing our volume, our sales.
Tonight, we're clearing the air in a News 8 Town Hall special on vaping. Here are News 8's Darren Kramer and Lisa Carberg.
Hi, everybody. Thanks for joining us tonight to talk about this important topic that affects so many families in our state.
Yeah, kids are getting their hands on electronic cigarettes, and now the state legislature wants to do something about it. But is a new law actually going to fix the problem? Let's take a look at the facts. According to the most recent CDC report, nearly 20% of high schoolers nationwide, that's 1 in 5 kids, reported using e-cigarettes. 5% of middle schoolers. The overwhelming majority of teen users, about 83%, use flavored vapes.
When it comes to addiction, that's where this really gets scary. Of high school e-cigarette users, 23%, that's nearly 1 in 4, say they vape every single day. Almost 10% of middle school users also vape daily. So, what's the answer? Governor Lamont and state Democrats say an all-out ban on flavored tobacco products, and in some cases that includes menthol cigarettes, which have been popular with adults for a long time.
News 8 chief political correspondent Jody Latina breaks down both sides of the controversial legislation that is on the table.
Fruity flavors, eye-catching colors, e-cigarettes and vaping sticks are in. Menthol cigarettes still hot.
What are we marketing to our children, and how do we control that?
In the long run, we will be so much better off financially, health-wise, in every way.
There are several bills being debated at the Capitol. All ban flavored tobacco products, including vapes and e-cigarettes. The Public Health Committee bill also bans menthol cigarettes.
Many people from the black and brown community came out to say that they have felt targeted by having menthol in their communities, and were asking us to do something.
A governor's bill does not ban flavored cigars or menthol cigarettes. Yale School of Public Health, Dr. Friedman.
What you're talking about doing is taking away flavored e-cigarettes, but leaving flavored little cigars and menthol on the table. From a public health perspective, that does not make sense.
The governor's bill does crack down on the tobacco industry. Spot checks on businesses by special agents, a cap on nicotine, a tax. Business owners face civil penalties, and the license to operate could be revoked. Employees could face individual fines.
They're the ones that would be fined or, held responsible if they're selling these things.
The Public Health Committee bill includes revenue losses of nearly $300 million and estimates it will cost up to $635,000 to hire more state employees for enforcement. Complicating the debate, lawmakers also considering making marijuana legal in Connecticut.
This in particular, highly hypocritical, that we're going to have a debate on marijuana gummy bears and at the same time ban watermelon vape.
The Office of Fiscal Analysis says any money collected because of violations will not make up for the loss in tax revenue. Jody Latina, News 8.
This is a complicated, multifaceted issue, so we brought together folks of all ages from all walks of life tonight on both sides of this debate.
Our panel tonight includes lawmakers, anti-tobacco advocates, Connecticut's Attorney General, owners of vape shops and convenience stores, and more. And we want to remind everybody on the panel to keep your answers brief so everyone has a chance to speak. All right, Senator Saud Anwar, let's start with you. You're sponsoring the Public Health Committee bill. There are two. How will that legislation protect teens?
Well, it's a step in the right direction because right now we can see that we have an epidemic of children being exposed to tobacco products and they're getting addicted to some of these chemicals. These are very addictive chemicals, and what we are trying to do is trying to target a way to stop the companies who have been blatantly targeting our children, whether they're the minority children or non-minority children, through these flavored products. And this bill is going to be able to address that by making sure that this access is controlled. And we can talk more in a little bit.
Matt Myers from Tobacco Free Kids, same question. Is a ban effective in protecting teens?
A ban would be very effective. What we have seen is that literally 30 years of work in Connecticut is being undermined. Connecticut has reduced youth cigarette smoking from over 30% down to below 6%. But today we have more kids addicted to nicotine than we have had in the last 20 years. And there's one reason: flavored e-cigarettes. We remove the flavored e-cigarettes, we'll remove the product that appeals to our kids. And it's important because you also mentioned menthol cigarettes. People don't realize half of all cigarette smokers who start smoking as children start using menthol cigarettes. Menthol cigarettes are a starter product. They are as critical to both eliminating tobacco use among our kids and to eliminating the health disparities among our Black and Latinx communities.
All right, Matt, thank you. You know, some of these proposed bills have no wiggle room and don't achieve the balance of getting adults off of combustible cigarettes while keeping flavored vapes away from kids. The question, is a ban the answer here? Andrew O'Bright, let's go to you.
Hey, how you doing? The FDA is currently investigating all of these products. A pre-market tobacco application has been submitted for any product legally on the market right now. And part of that process is that they have to demonstrate that they lessen youth uptake while simultaneously being able to get combustible cigarette users off of the product. So on top of, this being an answer that acts in a larger way, we need to make sure that we're not forgetting about those smokers. We have tens of thousands of Connecticut residents who rely on these products every day. And it's also worth mentioning, over the past 3 years, with FDA investigations going on, they've found that less than 0.5% of infractions for underage use are stores that we have in our trade association. So obviously there's another underlying issue of enforcement here as well.
All right, there are some other proposals floating around now, too. The Committee on Children has a proposal now that allows businesses to sell flavored vapes if they agree to ban anyone under 21 from coming into the store. No soda, no snacks, no service if you're underage. So is that a possible solution to this? Nikki Colley, let's go to you.
It is absolutely not the way to go. Let it be clear that our members are 100% committed and supportive of the goal to eliminate underage smoking. In fact, licensed tobacco retailers are the only face-to-face gatekeepers preventing underage youth from buying products that they are not legally allowed to buy. We enforce illegal tobacco products are only being sold to adults 21 years of age and up. We can't get lost in the fact that the people that work in these stores are members of the communities they serve. They are mothers and fathers, aunts, uncles, brothers and sisters that care. And we train our employees and implement age verification methods to ensure that the only people who are purchasing these products are of legal age. Our association and members, we voluntarily participate and endorse the We Card program, which is designed to help train employees to comply with federal, state, and local laws on preventing age-restricted products to minors. So And, with that being said, there always can be more done, in the stores, and we are working on that. There are hundreds of stores that are implementing scanners to scan IDs to make sure they're valid, and we plan to have many more do that. And I would like to add that right now, the FDA verified compliance is over 90% in our state amongst our licensed retailers.
All right, Nikki, thank you. Right now, the governor's plan does not ban menthol cigarettes. What do you think? Is that a good thing or a bad thing? Senator Anwar, let's ask you.
It's a bad thing because I can tell you menthol cigarettes are part of the target that has been, the industry has targeted the African-American community very heavily. If you look at all the African-American community members who actually started smoking, almost all of them were through menthol. If you look at the FDA records, the FDA itself has identified that the product, that the way it's been marketed, the way it has been looked at with the modeling that has been done, each and every aspect was specifically targeting our inner city African-American community members, and the results pan out. Literally 2/3 of all children have passive smoking exposure to menthol, and then they're actually also in the process of very high risk of getting exposed to it and then subsequently picking that up. This is a very significant issue, and yes, this needs to be addressed, and I don't think the governor's governor's bill goes far enough.
Some lawmakers say that Connecticut right now does a poor job enforcing the law on the books, especially at those convenience stores where most teenagers get their vapes. Would more boots on the ground help in that? Matt Myers, let's ask you.
It's a great question. Just, two quick comments. If the current laws worked, we wouldn't have a youth e-cigarette epidemic. If the current laws were sufficient, we wouldn't have African Americans dying of lung cancer, heart disease, and chronic obstructive lung disease because of the targeted tobacco marketing. The new laws will actually make enforcement easier because it's very hard to police age. But what is easy to do is to walk into a store and tell whether or not you're selling watermelon flavor or strawberry flavored tobacco products, so that it will make enforcement easier. We also know from other states that have engaged that have done this, that they've seen a dramatic decline. We're beginning to see significant declines in youth use, and we can eliminate a major cause of the health disparity in the African American community. So the short answer is enforcement issues are not a reason not to protect our children and not a reason not to protect our African American community. These laws will make enforcement easier, not harder. They will make it much simpler because you won't have to ask difficult questions.
All right, thank you. There are a number of different flavored tobacco products on the market. Of course, the vape juice that goes into e-cigarettes, but there are also flavored cigars and menthol cigarettes historically marketed toward the Black community, as we've been talking. And there are flavored tobacco chews as well. So should responsible adults who smoke flavored products be willing to give up that to protect kids? Nikki Colley.
I almost forgot to mute myself there. We do not believe that responsible adults should have to give up access to these products because responsible adults are not the problem. What we should really worry about is the irresponsible adults that will take advantage of restrictions like these to market and to sell to underage youth. Those irresponsible adults are operating in illegal secondary markets with no moral compass, who we can't legislate or control, and how are we going to protect those the youth from those kind of people? The thing is, you don't have to like tobacco or vaping or use it for that matter, but you need to accept that these are legal adult products with tremendous market demand. And we all know where there's a demand, there is a market. So we have two options. We can either continue to oversee the lawful sale here and allow the law-abiding, tax-paying businesses I represent to gatekeep the sale of tobaccos to adults, or you can implement the localized ban and have these adults driving up to New Hampshire like the people in Mass are doing and obtain their tobacco products there.
Okay, let's go to Commissioner Siegel. Can you explain how this bill would be implemented from your end?
Absolutely. Thank you for having me. So since about 2016, the Department of Consumer Protection has been registering retailers who sell these vape products, as well as the businesses who are manufacturing them in Connecticut. In terms of some of the enforcement, we work with several of our sister agencies, such as the Department of Mental Health and Addiction Services and the Department of Revenue Services. who already play a role in spot checks of current existing laws to ensure compliance. So if this flavor ban goes into effect, we would kind of continue and expand our process through that. We would first of all notify everybody registered with us of the new laws so that they can all get into compliance. And then the enforcement would be integrated in with the spot checks that are already occurring. And if we're alerted by our partners that they're still violating the law, we could ultimately revoke a registration.
All right, Commissioner. And coming up next year on Clearing the Air, diving deeper into exactly what vaping does to teens.
We're showing you how devastating it can be to young lungs.
Also, what about the adults who switched from smoking cigarettes to vaping? How this potential ban could impact them. And a lot more with our panel too. A town hall on vaping continues here in just a moment.
Welcome back. We are above the national average, but this is not a statistic to be proud of. 27% of Connecticut high school students use e-cigarettes. That's 7% higher than the average nationwide. So what vaping does to young people is concerning to medical experts. A recent CDC study found that 99% of the e-cigarettes sold in the U.S. contain nicotine, which can harm the developing adolescent brain. I spoke with a pulmonologist about what he's seeing.
Vaping kids concerns me a lot as a doctor, concerns me a lot as a parent.
St. Vincent's Medical Center pulmonologist Phil Simkovitz says because vaping is not as harsh as cigarette smoking, younger people may be prone to inhale more.
When you see the pictures of kids vaping and the vapor coming out of them and the amount that they use, it's really staggering.
He says vaping in young people is a gateway because nicotine is an extremely addictive substance. That could lead to cigarette smoking, which is known for its proven health dangers. He has seen lung damage in patients from vaping.
The inflammation in the lungs can lead to some scarring and some long-term damage. Well, the acute presentation when patients got sick was really very much like a pneumonia, where people were short of breath, they were coughing. There was chest pain.
Dr. Simkovitz says vaping puts a number of substances into the lungs, including heavy metals.
Cadmium and lead may cause direct damage. The rest seem to cause damage by inflammation.
Even lead, he says, and it is a new phenomenon for doctors.
The thing about vaping is we don't have a lot of years of people vaping to have long-term experience as to what are going to be the long-term effects.
Another concern of his is that children are not as equipped to recognize addiction or know how to get help for it.
All right, Dr. Collins, you are a pediatric pulmonologist with Connecticut Children's Medical Center. Describe some of the things you've seen in your patients who have vaped.
Unmute for us. There you go.
Sorry about that. For our patients who have vaped, we've seen symptoms all the way from daily chronic cough, mucus production, and congestion, up until the more severe cases where we see need for additional oxygen and irreversible damage on CAT scan, as well as pulmonary function testing. In other centers close to us, such as Boston, there have been lung transplants in adolescents secondary to vaping. And the thing that's important for people to understand about the e-cigarette vaping associated lung disease, or EVALI, is that 14% of all of the cases and 29% of the fatal cases were from users who only vaped nicotine. So there truly is no safe vape product for your lungs.
Wow, middle school lung transplant. All right, doctor, teens often think they're invincible, then what they do now won't have long-term consequences. But when it comes to vaping, there are long-term side effects, right, Dr. Collins?
Absolutely. So the long-term effects not only cause damage to your lung, but they also increase your risk of having a heart attack by 1.79. Furthermore, the drug nicotine that's delivered by your e-cigarettes increases your risk of both marijuana and alcohol abuse. And lastly, there have been several episodes of severe, significant facial burns and injuries, which cause lifetime hardship for the kids that sustain them. And it really escapes people, but it's important to remember that this isn't just some harmless thing that you do with your friends. Vaping can lead to one of the worst diseases that Americans face, and that's the chronic disease of addiction.
I would like to add something into that.
Sure, go right ahead.
So a couple of things. Number one would be that was self-reported on Valley. It is very likely that 100% of the cases were THC users in that. And there were some vitamin E acetate found in pretty much every single case where a device was tested. And that can only be used in THC devices.
So Andrew, I would actually respectfully disagree on that. So this is from a recent publication of the Annals of the American Thoracic Society just this month in April. So there may be some new evidence that not everyone's aware of.
Okay. Well, I'll also just tell you that your cardiovascular event was done by Stanton Glantz. That has since been retracted. And the reason being because that study was done in a way that is not scientific. So the cardiovascular events that were reported were prior to vapor usage. So these were former smokers that had cardiovascular events. When they were smokers and subsequently switched to vapor products and did not have a cardiovascular event, they did say during that study that those were cardiovascular events that happened because of vapor products. And somehow
again, I would respectfully disagree with you because that was also in this month's Journal of the Annals of the American Thoracic Society. And if you take a look, it also talks about the other cardiovascular events such as increased heart rate, blood pressure, and arterial stiffness.
Yeah, studies.
This study has not been retracted. I know the study you're talking about, but this is a different one.
Tell you what, guys, there are a lot of studies. We understand we're kind of deep in the weeds here. Let's bring this back around here. According to Tobacco Free Kids, there are more than 15,000 e-cigarette flavors out there. And it's not just things like mint and menthol. There are also candy and dessert flavors like root beer float, gummy bear, and cotton candy. Dr. Collins, is it true that certain flavors can have a more damaging effect on the lungs of adolescents? Is that right?
I think it would be hard to isolate any one particular flavor because, as Mr. Myers mentioned, there's also heavy metals when you're vaping. What we do know the most about is the diacetyl, because diacetyl vapor has been investigated for a long time, specifically in occupational exposures. And that does lead to obliterative bronchiolitis, which is a long-term lung injury. There are also cases with some of the fruity flavors of causing severe immediate damage and respiratory failure. And this is because it is a non-regulated product. So when you inhale, you don't know what you're inhaling. And again, as a pulmonologist, my recommendation is to just breathe clean, pure air. Don't inhale anything else into your lungs.
All right, Matt Myers.
The whole diacetyl thing, I will just say, that's been disproven about 100 times since then. And the reason is because there's only ever been 8 known cases of popcorn lung, which is what you're referring to. And those 8 known cases were from a popcorn factory where people inhaled diacetyl at 10,000 parts per million. And e-liquids no longer have diacetyl in them. Unfortunately, for the past 5 years, that's been the case.
Matt Myers, let's stay on this flavor topic here for a minute. Can you talk about the evidence you have that these flavors are really what is enticing teens to vape?
Yeah, the evidence is irrefutable, actually. You know, flavors were heavily introduced in around 2015. Juul really was the one who started marketing them very effectively to our kids. Between 2015 and 2019, we saw a meteoric rise in youth e-cigarette use and a rise in the number of our kids who are addicted. During the same period, we saw no increase whatsoever in the percentage of adults who are using these products. What it means is that the introduction of flavors is accompanied by a dramatic increase in youth use and virtually no increase whatsoever in adult use. There was a study that was just published 2 weeks ago by actually many individuals who are very supportive of e-cigarettes, who commented that the introduction of Juul and the introduction of the flavors with Juul was not associated with any increase in youth adult use of these products for cessation. So we're actually not really talking about youth versus adults, because the reality is adults are not using these products for cessation, the data says.
Well,
yeah, the data also says 90+% of adult users are using flavored products. So how can you say that when 7,000 people say exactly the opposite?
Well, tell you what, hold on, guys. Let's get to those adults, because that's next on our list here. Another angle on this. Former smokers we've spoken with, and there are a bunch of them, do call vaping a lifesaver.
I haven't had bronchitis since then. I can breathe again. It just, to me, in my eyes, it saved my life.
The debate, as we just heard, over vaping as a smoking cessation tool. Can it really help you quit?
Plus, one of the proposals on the table would ban menthol cigarettes. We'll take a look at why the issue of a menthol ban is a particularly complicated one. We'll be right back.
One group of people who are against banning flavored vape, former cigarette smokers who have switched to vaping. They say they want the choice of flavors and that vaping is better for them than smoking, and the science says they're right.
It saved my life.
Al Maldonado from East Haven smoked 2 packs of cigarettes a day for a quarter century. 5 years ago, he switched to vaping. He says the improvement in his health has been quick and dramatic.
I don't get bronchitis anymore. I used to get bronchitis every year. Sinusitis, constantly wake up, coughing up stuff. I haven't had bronchitis since then. I can breathe again. It just, to me, in my eyes, it saved my life.
Al says he and his co-workers all switched from smoking to vaping and use a variety of vape flavors.
Do you think it's a mistake for the state to limit the kind of vape you can get for people for adults who are stepping down from smoking?
I can see the part with the minors and stuff like that. Absolutely, they should regulate that. But as far as adults, I mean, I believe I talked to hundreds, if not thousands, of people that have quit smoking because of this vaping thing.
The e-cigarettes are the less risky option than cigarettes. But
Dr. Abigail Freeman is a professor at Yale School of Public Health. She studies vaping. And while smoking and vaping are both bad for you, she says the science proves smoking cigarettes is worse.
If you weren't going to quit entirely, if that wasn't an option for you, it would be much better for you to vape than continue smoking.
It's a good step, a stepping stone from people who've smoked all their lives to giving it up. There is a place for it. And it's helped a lot of people. I know it's helped me. That's all I could say.
All right, let's talk about it. Is it a mistake to take away the flavored vaping option for the thousands of former cigarette smokers in our state who have now switched to vaping? Jonathan Shayer, let's ask you.
No. I mean, was the question to take away menthol cigarettes?
No, not menthol. It's about flavored vape. Smokers who have switched and used flavored vaping, should they have the option to continue using flavored vape instead of going back to cigarettes?
Sure. I mean, look, as representing retailers, if there's a legal product on the market and our adult customers choose to use that product, then we'll be there to sell it to them. And if flavors play a role in helping people off the ramp of combustible cigarettes, which is, I think, generally accepted as more harmful, then yeah, they should be there. Frankly, they should be alongside cigarettes. You don't want to create an impediment for people or an obstacle for people that that one time they go in to buy those cigarettes, and that's the time they're going to choose something that's less harmful.
All right.
Look, ultimately, you want to quit, but if this is one of the steps to there, then I think that it needs to continue to exist.
All right.
May I jump in here?
Go ahead, hop in.
Yes. So thank you for having us tonight. But let me just say one sort of myth that we're peddling right now is that vape is a valid smoking cessation treatment or tool. The smoking cessation product or tool or treatment program means something according to the FDA and according to medical science. And nobody, to my knowledge, the FDA, any recognized authority, has said that vaping is effective for smoking cessation. So we should just stop talking about it as a valid smoking cessation treatment program. It is not and has not been proven to be such.
What if the FDA were to find that this is appropriate for the protection of public health, which is what they're doing right now?
With all due respect, they haven't, period. End of story.
That's the process they're going through now.
What's happening right now
These
is
products
that
would be off the market if they found that.
companies like Juul are misrepresenting and actively deceiving people into thinking that these are smoking cessation products when they are not. And by the way, that is unlawful.
But Mr. Tong,
I agree with the Attorney General
the science, if I may, the science does say, while it may not be a cessation tool, it is safer if somebody's not going to quit. And it'd be a perfect world if everybody quit all of this. But if somebody's not going to quit, it is a safer option to vape rather than smoke. Is that valid for these folks who are unable or can't quit everything to step down to vape? That's their point.
Two things. No. I think it would be one thing to say it is safer and to present some science to suggest that that's the case. That is very different than saying this is a smoking cessation product. And if you use this product, we can help you stop smoking. That's what they're saying, and that is false.
Attorney General, the PMTA process, anything that's going to receive a PMTA authorization is going to have to be beneficial to the public health. And I would hope that the state of Connecticut would want those products to be available. Those products that receive PMTAs, I would hope that the state would want those available for anybody, but particularly for people that are trying to stop smoking cigarettes.
Well, and I appreciate you saying that, because I would hope that the retailers would join the state of Connecticut in prioritizing public health above all, number one, and stopping the epidemic of youth vaping. And so, frankly, the question about adults is not relevant to the public health emergency that we face right now, which is the epidemic of vaping by children. I haven't heard anybody on this Zoom say that kids should vape or that they should smoke.
Well, of course not. These are age-restricted products. And retailers do play a role. They play a significant role as the gatekeepers for these products. Look, you have a choice. You can have it sold through the legal, licensed, regulated, enforced framework that you and the state have created over decades and continue to enforce. And look, if there are bad actors in that network, they should be removed. They should be fined and have their license pulled. But
with respect,
the alternative is online, other markets, black markets, where you have no control.
Gentlemen, we have to move on. We appreciate both of your sides, but we do have to move on. The Public Health Committee's proposed ban on flavored tobacco products includes menthol cigarettes. And according to Tobacco Free Kids, Big Tobacco has aggressively marketed menthol products to African Americans for decades.
One of the greatest marketing coups that took place in the 20th century is transforming menthol cigarette to a black cigarette.
During my time with Truth Initiative, I read dozens of research articles and stacks of internal documents directly from tobacco industry files. The tobacco industry strategically and successfully infiltrated my community. And while it's true that they targeted many groups, the targeting of the black community has been uniquely damaging.
Okay, that's an excerpt from Black Lives, Black Lungs. The short film examines the tobacco industry's infiltration into the black community. Tobacco companies have historically placed larger amounts of advertising into African American publications, exposing African Americans to more cigarette ads than whites. Not only that, but menthol products are given more shelf space in retail outlets within African American and other minority communities. All right, right now, the vast majority, about 85% of black smokers smoke menthols. That's compared to just 29% of white smokers. When it comes to young people, over 7 out of 10 African Americans ages 12 to 17 who smoke menthol cigarettes, according to the CDC. So what's the big deal about menthol compared to the other kinds of cigarettes? A 2013 FDA report found that menthol's cooling properties can reduce the harshness of cigarette smoke and lead to increased smoking initiation among youths and young adults, greater addiction, and decreased success in quitting smoking. All right, keeping all that in mind, why is it so important for the Public Health Committee to include menthol in their proposed flavored tobacco ban? Senator Anwar, tell us about that. Your bill addresses menthol cigarettes.
Yes, I think this is a civil rights issue. What the tobacco company did was a genocidal activity. They actually have targeted the African American community, the minority communities for so many years, and the numbers pan out and show the results clearly at this point. And if you look at the risk of death from tobacco-related issues, the African American community is at a high risk for lung cancer. They're high risk of COPD. They're high risk of other respiratory problems, and they're dying at a younger age as well. and then ongoing marketing towards them has been part of the problem. And now the same companies are saying, well, if you remove this product from that community, you are being unfair to the community. And it's the amazing how they market and how they work, because they have specific on all the numbers. The FDA has seen this, the CDC has recognized this, but this is the time for us to use the law to protect the community, and the laws are to protect the next generation. We may have some of the people who will be unhappy with this policy, but we are trying to save the next generation of children, and that is why this ban is critical for saving the next generation of our minority children.
Okay, for many supporters of the ban, this is really about ending a cycle of preying on African Americans in order to sell menthols. Nicola Hall, talk about the cycle and why it's been so hard to break thus far.
Yes, hi. So I'm super happy that you guys showed the Black Lives, Black Lungs, and I encourage everyone to check that out. It's very impactful. And that film investigates the tobacco industry and how they infiltrate the Black community. African Americans have been the primary target of the tobacco industry campaign for over 50 years, and they have caused so much damage to families, resulting in over 45,000 deaths yearly. And it's a scientific fact that the African American brain, the brain chemistry, plus access that we have in our community, mostly urban community, it makes it difficult for them to break the addiction. And you know, I hear the conversation that's going on, and this is one of the things that is so passionate about. I'm passionate about my community because we are always exploited when it comes to things that put us in arm's reach. So the menthol cigarettes, which are more addictive, are literally in every corner store or gas station, and they're cheaper in the Black and brown communities. And tobacco companies, they give out free samples to enhance or entice us or trap us on this poisonous products. Why?
That's not true. That's not true.
In addition, let me finish. If you watch, let me finish. In addition, and it just states the fact that the menthol flavor cools and numbs the throat, right? And it reduces the harshness of the cigarette. So if you start smoking young, it's so much harder for you to quit at an older age. And that's. Go ahead and say what you have to say.
I'd like to know where you see free samples given away.
Free samples were given away regularly until the
which decade are we talking about? Which decade are we talking about?
They were given away regularly until the federal government prohibited it.
That may be true.
Of a lawsuit brought by the Connecticut Attorney General and others. But what it does say is that this industry flouted its ability to target this community, the youngest members of this community, and the only time it stopped was when the law required them to stop.
Mr. Myers, but we're not talking about 1970 or 1980 when Joe Camel and
Joe Camel
were on Billboard. We're talking about.
Tell you what, guys, let's bring it to modern day. Let's talk about our neighbors here for a minute on the same topic, okay? Here we go. Some states, they're still talking. Everybody, I'm going ahead. Here we go. Some states, including Massachusetts to our north, have banned menthol cigarettes, but some believe that has created another problem, a black market for menthols. This is undercover video obtained by News 8. Shows single cigarettes, commonly known as Lucy's, being sold on the streets of Boston there. Jonathan Scher, I know this is a big concern for your industry. Is it better to have regulated flavored vape out there than stuff that could be floating around the black market if these flavors are outlawed? What do you think?
Oh, of course. Black markets are a big concern for us, and they should be a big concern for everybody. We know that these black markets for tobacco products exist, just like they do for marijuana and just like they do for sports betting, ironically, which Connecticut is seeking to legalize. In Governor Lamont's own words during his budget address, he used, rather than surrender the market to other states or a black market. So we know these markets exist. And ironically, we'd be sending tobacco back into the shadows of a black market with this policy. Right. So look, it's critical to recognize that these products have enormous market demand. Menthol cigarettes alone are a $380 million market. You can't just abandon that market and assume it's going to disappear. It's going to find, demand always finds a market. So the question is simply this: do you want it sold through a system that you can regulate, enforce, or do you want it brought in from New Hampshire, which, by the way, is the #1 export state in the country because of its relatively low tax rate, the casinos, online, and of course, black markets.
Okay.
So yeah, we need it. We need to keep it in the regulated framework for sure.
Senator Anwar, this one's for you. This is a question from the executive director of the Smoke-Free Alternatives Trade Association, Mark Anton. Listen.
Do you believe it's better to have regulated products that the FDA has reviewed versus illicit products that nobody's reviewed and has no scientific evidence on in the hands of any American citizen or Connecticut citizen?
All right, so what do you think? Are you concerned the Public Health Committee would create a black market here?
No, if you look at this argument, that means that we should legalize everything. And then that's probably not the way to approach things. First of all, the black market argument and also the studies that have been done has been done by the menthol producers. There's only one study that was done. It was done by the company that makes the cigarette. But if you look at PubMed, go and look at the literature that is about menthol when people do not have access to it, they give up smoking. That's shown in a meta-analysis that was published in 2020. Initial studies were done in 2010 when there were policymakers talking about stopping this. So look, the people who have a business interest will fight for this because it's their business interest, that's their livelihood. But the reality is that we know from studies of 2,800 some people that was recently also published that when they were asked if the menthol cigarettes were not available to them, would they stop smoking? And majority of them said that they would. And as far as the black market is concerned, we have Connecticut agencies that are supposed to oversee that and protect us.
Thank you. We have to move ahead much more. Clearing the air coming up next. We'll be right back. You've heard the facts about vaping. Now we will hear from a local college student who was addicted to vaping. He's speaking out to help others and to stop others from vaping. News 8 chief political anchor Dennis House spoke with him.
What the heck is that? And they're like, oh, it's just like water vapor, you know, it's like harmless.
And that's how it started for this former high school football and baseball player. Liam Coleman is now a 20-year-old college student whose high school memories include an addiction to vaping.
When I first tried it, I didn't really know what it was.
But before long, Liam was vaping all day long.
When I was really addicted to vaping, it was like wake up in the morning, and like the first thing on your mind is like, oh, I gotta hit the vape. You know, you're like, if you don't hit it after a while, you get kind of cranky. Brush my teeth, hit the vape, go to sleep.
And when not at home, Liam vaped at Portland High School.
Locker room before games, bus rides, in the bathrooms, literally like in the classrooms.
But by spring of senior year, Liam's addiction had come to a head, and it took away something he valued dearly, being an athlete.
I was in the bathroom, I was in the stall, and a teacher walked in and saw it. And yeah, I got suspended from school, and I got kicked off the baseball team for it.
After that setback, Liam looked ahead to his future and knew he had to quit.
What is your message to the 14-year-old out there who's being tempted by vaping?
It's very addictive. It's bad for your health. It just doesn't look cool. Even though you think you might want to fit in, just being yourself and just not following the crowd is definitely way cooler than just trying to follow the crowd.
I'm Dennis House, News 8.
All right, joining us now is Kathleen Redman. Your connection to this debate is deeply personal. Tell us about what happened to your own son.
Thank you for having me. And I really give Liam a lot of credit for coming forward and trying to quit. I think it's easier said than done. My son was 13 when he started vaping. It was a Juul mango Juul that he first tried. And of course, he was hooked almost immediately. This was a child who hated the smell of cigarettes, you know, would politely ask people near the park to leave if they were smoking. He wanted nothing to do with cigarettes. And yet this smelled and tasted like candy. And again, I give Liam a lot of credit. These teenagers, it's so hard for them to quit. It's a physical addiction. It becomes such a point of desperation for them that they will do almost anything to get their hands on it. And it all comes back to the flavors. It's an on-ramp to smoking, because to cigarettes, even if he can't get his hands on a Juul pod, he will use cigarettes. So just as Matt was trying to say earlier, This is a problem. It's a national epidemic where we are creating another generation hooked on nicotine, and they will do anything to get it, my son included. He now has health problems that.
All right, I think we lost Kathleen, but we thank you for sharing your story. All right, Greer Levy, you saw Liam's story, and you've had similar tales among your peers who become addicted to vaping. Talk to us about that.
Well, smoking flavored tobacco products has definitely run rampant at my high school. It's become so common that even walking into the bathroom, you see people either using them or you kind of smell it in the air. And with the friends I have who do smoke these products, you can kind of tell how addicted they are because first of all, you can kind of smell it in their breath, and you can also hear it in their voices. It's pretty scary.
All right, let's talk to Phoebe Lampos now, a sophomore at Old Lyme High School. Talk to us about why you are interested in this topic, Phoebe.
Yeah, I'm really involved in this topic because I think that it's really important to attack this problem before we destroy future generations. As Ms. Redmond was saying, I'm seeing students who would never ever pick up a cigarette, and they're starting vaping really early on. And by the time they're in their senior year, for example, they're addicted to substances like tobacco products and really harmful substances, and we really need to stop that.
All right, Phoebe. Yeah, thank you. Oh, a lot of stories here tonight. Coming up here, we're going to have the panel's final thoughts on the flavored tobacco product ban, the possibility of it in Connecticut, when we come back.
All right, we'd like to give our panel a chance to share their final thoughts on this topic in about 30 seconds. We'll try to keep it brief. First, let's start with Matt Myers.
Thanks for doing this. This is an incredibly important issue. You know, we let cigarette companies market to our kids for 40 years, 50 years, and we're still paying the price. E-cigarettes are only 5 years old. We can reverse the youth e-cigarette epidemic, but we've got to get rid of the products that are causing that epidemic. And we have to tackle the problem of menthol cigarettes. It's not old news. A study done by Stanford demonstrated that the industry continues to market in stores close to the lowest income neighborhoods and close to schools even today.
Okay, Matt, 30 seconds is up. John Scher, your turn.
We need to draw a line between e-cigarettes and traditional tobacco products. They do not have the same user profiles. One continues to show alarming youth appeal. The others are clearly adult products. We can address e-cigarettes, and we can leave the adult products alone. We also need to recognize the enormous market demand of those products and be very careful that we don't send them into a black market where we create a problem we cannot control.
All right, thanks, John. Nicola Hall, you're next.
Yes, so I just want to share that the tobacco companies have no moral compass. When an executive was asked if they smoke cigarette, this is what they said. We don't smoke that ish, we just sell it. We reserve the right to smoke for the young, the poor, the black, and the stupid. Thank you.
All right, Nicola, thank you. Senator Anwar, your final thought.
We have an opportunity. If we were to go back in time, we would have said that we would have banned some of these products early enough so that we could have saved so many lives. Today is the present is a part of our future opportunity to save lives. And the bill that we have from the Public Health Committee is just the right bill that is going to help save lives. So I would encourage people to recognize the reality and protect the generation. The next generation, we have to protect it. And all communities we have to protect, especially the minorities that have been targeted by these companies. Thank you.
Thank you, Senator. Andrew O'Bright, you're next.
Take your
unmute, please.
You're muted.
Unmute.
Unmute for us.
No, we can't hear you. You're still muted, Andrew. If you can hear us, please unmute.
One more try.
All right. No youth should take up vaping or have access to adult vapor products. We're on the precipice of what could be an enormous negative public health outcome or infancy of a profound public health win. Prohibitionist policies have never been proven to be effective. So let's work together to make policy changes to make a positive difference in the Connecticut residents, and let's use a scalpel instead of a sledgehammer.
All right, Michelle Siegel, your turn.
Thank you for helping draw attention to this issue. Our goal at the Department of Consumer Protection is to protect public health and safety, and we're proud to be doing our part and to be working with our sister agencies on enforcement related to vaping and vaping products as they exist now, and any new laws that may be passed this year.
All right, Attorney General Tong.
Thank you. So more than 20 years ago, Attorney General Blumenthal took on the tobacco industry because they were targeting kids. Today, the former Philip Morris Altria owns about 40% of Juul, and they're doing it again. They're marketing directly to kids with flavors, with social media influencers. They're trying to make it cool, and they're telling people that it's a smoking cessation tool when it's not. And that doesn't just deceive adults, it deceives children into thinking that vaping is safe. We have to take action now. The focus should be on kids and stopping youth vaping. We have an epidemic of youth vaping. I haven't heard anybody say that we don't, and the state needs to take strong action.
All right, Nikki Colley, your turn.
Our members are not expert in public health issues, but we do support the sale of legal products to legal age adults. We are the regulators, gatekeepers, and time again, it has been proven that prohibition does not work.
Thank you, Nikki. Dr. Collins.
You know, I speak to the teens out there who heard a heated debate tonight about scientific facts. I would encourage you to look at solid peer review studies that are not sponsored by the tobacco industry. Vaping is not safe, it is not regulated, and you don't know what you're inhaling in your body. I urge you to keep your lungs safe for the rest of your life and just inhale pure air.
Kathy Redmond.
Please, please help moms help their kids prevent addiction, prevent the kids from becoming addicted. I can name 5 retailers within a 3-mile radius of my home that will sell these flavored tobacco and vaping products to children who are under 21. And moms can't do it alone. We need your help, legislators. We absolutely do.
All right, Kathy, thank you. And listen, we want to thank each and every one of you for joining us tonight for this virtual town hall discussion. A lot of great information tonight. Thank you for keeping it civil and informative. We appreciate it.
Good discussion. All right, thank you for watching. News 8 at 8 is next over on WCTX.